Good evening, my wonderful social media followers, my YouTube channel subscribers, my Facebook family, friends, my Instagram friends. You know, now I am speaking to more than just people in Kenya. I'm speaking to people in Africa. I'm speaking to people outside of Africa because diabetes and other kind of metabolic syndrome conditions and lifestyle diseases are conditions or diseases or lifestyle eventualities that are not just peculiar to Kenya alone. These are things that are found uh, out of the reach of our borders of Kenya. So now I have friends in America, I have friends in Canada, I have friends in Australia who are my subscribers, and I welcome you all to my channel this wonderful evening. The device that I have is a tablet, an Apple tablet, and for some reason it doesn't allow me to record live on YouTube. So I'm forced to do the video first, record the video first, prop up myself, prepare myself, and then record the video and then upload it. But I believe that the information that I've prepared for you today is going to be of benefit and of use to you. If you have a friend, if you have a family member, a loved one, a spouse, a partner who is struggling with diabetes, invite them to be a subscriber on my YouTube channel. I speak about diabetes, I speak about lifestyle diseases, I speak about autoimmune conditions. I do cooking on my channel. I talk about my walks. Last week on Monday, I walked all the way to Maragua, which is 61 kilometers from my house in Kaharawendani. So I want to engage with the public. I want to engage with people who are health conscious, people who want to get better, because I myself have gotten better. I've been able to shed off about 13 kilos of weight. I had initially lost 23 kilos, but I was too underweight. So I've been on a bulking diet. I've been on a diet called the Carnivore Diet that has helped me put on a bit of muscle so that I can also strengthen myself. So my goals now are toward building muscle while still maintaining a low blood sugar, and not just building muscle but having very little body fat, which is now what I'm targeting. So today, what are we talking about? Today, we are talking about living with diabetes, and I'm going to call it part one because I'm going to talk about my own experience, how I have gone through living with type 2 diabetes, and we are going to look at rewiring our mind system. We are going to look at rethinking what we know about diabetes. We've been told in the past that if you're diabetic, you have to eat 6 meals a day. If you're diabetic, you cannot fast. Can I shock you and surprise you that my phone actually says that I'm 48 hours into dry fasting as of now. I started my dry fast on Monday at 9:30, and I do this regularly on a monthly basis because I also want to reset my body system. I want to set in what we call autophagy, and this helps me a lot because it is an anti-aging mechanism. It also helps me balance my blood sugars. It also helps me use up the fat that may be stored in the liver, because when you go on a fasting, what happens is you break down what we call there is a breakdown on the fat in the liver, and then that breaks down into what we call glucagon, and that is released as energy in your system. So today we are going to talk about diabetes, and I'm going to throw in a bit of my experience as well, so that you can also get to understand where I'm coming from. So basically, we are rewiring what we think about diabetes. Are we together? Diabetes is not a disease. I'm going to shock you. It's not a disease. And I know you're going to start thinking, what is Munge talking about today? We know diabetes to be a disease. No. Diabetes is not a disease. Diabetes is an impaired sugar metabolism. It is an irregular response to having an excess load of carbohydrate in the body. So when you talk about sugar, it's not just that white sugar that you put in your tea. We are talking about carbohydrate, we're talking about starch, we're talking about, in Kenya we have what we call chapati, in America we may have tortillas, right? Things that have a lot of carbohydrate content in them. These are things that cause an irregular response in the body. So when you take this kind of foods in great amounts, the body gets a bit mixed up because it doesn't know how to utilize that excess carbohydrate that is in your body, and this is now the root cause of type 2 diabetes. All right. So the moment we call diabetes a disease, now then we are forced to give it a drug, because this is what the FDA in America talks about. They talk about prescribing medication for diabetes. So when we say diabetes is a disease, especially when I talk about diabetes, I'm especially talking about type 2 diabetes, don't get me wrong. Then if we say it is a disease, it means we need to prescribe a medication for it. However, we've also been told that diabetes is a lifestyle condition. And if you look at my channel, if you look at my Instagram pages, Munge Chef, Munge the Walker, if you look at my Facebook page, Munge Washira, you'll notice that I talk about lifestyle, and I live it. I live it because it's practical. I cook in the kitchen and I demonstrate to my viewers what I'm cooking. I talk about the food that I actually eat. And if you notice, 80% of my posts are on healthy eating. So even before I go to do my walks in Maragua or go to the gym, first of all, we talk about what it is that I'm eating. So if it is a lifestyle condition, it means that we can reverse the anomaly of the irregular behavior your body has in response to sugar only by altering what it is that we are eating. So if we alter what we are eating, we are going to alter that irregular response from sugar and reverse that condition which we call type 2 diabetes. So it is actually a lifestyle condition. Condition means if you do it this way, you can flip it over. If you do it this way, it can get worse. So a condition is actually something that is conditional, right? So let's call it a condition. Let's stop calling it a disease. Because if I'm living healthy today and I'm not on any diabetes drugs, I'm not on Amaryl, I'm not on metformin, I'm not on any insulin medication, okay? I'm not on Triviamet, I'm not on Humulin, I'm not on Novolin, I'm not on any FlexPen. So if I'm able to manage this condition using diet, and I'm going to talk about diet a lot, using diet and not medication, why can't you also do the same? Invite anybody who might be going through type 2 diabetes or blood pressure, having a problem with the blood pressure, or any metabolic syndrome condition, or even autoimmune condition, to view my channel, because there's a lot that I want to discuss and talk about, especially centered around diet. 80% will be centered around diet. Now, the first thing that we need to think about and always be cognizant, the thing we always need to be cognizant about, my dear viewers, is that in being type 2 diabetic, one is glucose intolerant. So you're actually intolerant to carbohydrates if you're type 2 diabetic, meaning you need to check on the level of carbohydrate that you're indulging in. You need to check on the level of carbohydrate that you're taking into your body, because this carbohydrate will be the cause of all the problems in your body. Now, let us talk about the signs of carbohydrate or sugar intolerance, especially in people who are pre-diabetic or diabetic. Feeling very thirsty, this is something I have been through. I struggled with diabetes prior to being 43. I struggled with diabetes for over 20 years, and these are all the symptoms that I used to have. I would feel very thirsty. I would keep going to the kitchen to get water to drink. I would have a dry mouth. My mouth is not as dry as it used to be, all right? Dry skin, my skin would be horrible. Eczema, skin tags. Somebody noted and said, Munge, your skin looked dark before. You looked older than you actually look right now. And that is true. Diabetes interferes with your skin, all right? So you also get skin tags and irregular skin pigmentation. You start getting dark spots around your neck or even around your arms. And then now, like now in Kenya, we have the cold season. It's June right now, so it's very cold. Around this time when I was really struggling with diabetes, I would get eczema attacks, all right? Eczema, and then I would have dark pigmentation around my neck, my arms, and also my legs. But all that is gone now, and I would itch a lot. Then there would be extreme tiredness. You know, you've eaten lunch, you've gone back to work at 2 p.m., and you're hardly productive because you're feeling so tired. So you see, that tiredness, that excessive tiredness that you have, ends up interfering with your work productivity, and also by extension will end up interfering with your relationships with other workers in the office and the productivity of your company, because now the teamwork now will be interfered with. If one member is always tired and fatigued because of diabetes, his work productivity is impacted, and that impacts on the activity of his team and by extension the activity of his organization. So extreme tiredness, blurred vision. I'm jogging at night even when I was struggling with diabetes, and then I see I'm having issues with my eyes. That was before, now that is not there anymore. Dizziness. Dizziness, why? Because of excessive urination. When you're diabetic, you excessively urinate, and when you're excessively urinating, you're getting rid of essential salts like potassium and magnesium. Now when you lose those salts, you're going to start getting dizzy, and this is why we talk about magnesium deficiency in people who are diabetic. Waking up at night to urinate, a classic sign of insulin resistance. This is found among type 2 diabetics, even people who are hypertensive, people who have PCOS, people who have certain forms of cancer, people who may be struggling with issues of their pancreas. Waking up at night is very, very common. And that is not that is something unusual, and that is something that you need to go and get a checkup with your doctor and just confirm what may be causing you to wake up at night to urinate frequently. So we've said frequent need to urinate, and then waking up at night to urinate, all right? Then you lose muscle mass. So if you're diabetic, you need to be careful because you'll start wasting muscle. Extremely dry eyes. This happens to people who are diabetic. That is something I used to experience a lot. I had even gone to see Dr. Kibata at City Eye Clinic because of dry eyes, and he cautioned me and told me if I was not careful, I would develop cataract. So this is why I'm so vocal about reversing diabetes and reversing hypertension. Moodiness, cranky when you're very hungry. This would be a very, very common occurrence for me. Nowadays, I've learned how to manage myself very well because the eating habits that I have do not interfere with my moods. Depression, irritability, anxiety, and panic attacks. All right, I've noticed this among people who are diabetic. Bloating and constipation. So all these are common signs of people who are struggling with diabetes. Then we also have irregular heartbeat, because when you have a deficiency in magnesium as a person who is diabetic, you're going to have issues with your heart, your rhythm. Your heart rhythm is going to have a problem. So you'll have irregular heartbeat. Now the treatment plan for people who are diabetic, number one, depending on the level of your sugars, there may be a need to start with medication, all right? So in terms of the treatment and the diagnosis, before we get to the treatment, we get to diagnosis. Diagnosis is done by a doctor. So we have what we call a random fasting sugar. So that means they'll prick your finger when you've woken up and you've not eaten, and then they'll be able to tell the level of your blood sugar. This can be done in a hospital or at a local pharmacy or chemist or clinic. They'll be able to tell your blood sugar level because you'll have woken up and not have eaten anything at that point. Another more precise result is what we call the glycated hemoglobin. Glycated hemoglobin simply means how your blood sugars have been performing for the last 3 months, period of 3 months. So this, you need to go to a specialized lab where they're going to prick, again, draw blood from you, and then they'll do a test called the glycated hemoglobin, and they'll be able to tell you on average what are the levels of your blood sugars, and we usually aim to be at least below 5.6. all right? So if we are below 5.6, it means that our control is good. If we are above 5.6, then it means we are pre-diabetic. Then if we go above 6 point something, it means above 6.2, 6.3, it means that we are diabetic. So now in terms of diagnosis, we have that, but we also have what we call the C-peptide test, and this one is used to diagnose if you're insulin resistant. Remember, if I told you if you're waking up at night to urinate frequently, That is a classic sign of insulin resistance, and you may need to get a C-peptide test. Of course, this one you would need a doctor to give you a lab request, and then you can head to a reliable hospital where they can do the test for you and tell you if you have insulin resistant, or if you have insulin resistance, or if you have insulin sensitivity. I hope we're together. So we talked about glycated hemoglobin, random blood sugar, and also the C-peptide test to check on your sugars. Medication. Now, we are talking about a treatment plan for diabetes. Initially, when the sugars may be too high and may cause you to be admitted in hospital, it may be necessary to intervene using medication to start with. They may decide to start with tablets, or they may decide to start with insulin. Insulin, we have various forms. We have Humulin, we have Novolin, we have Novdog, we have Flexipen, we have Fiasp, we have Apidra, Lispro, Tresiba, Levemir, Lantus, and Toujeo. These are all forms of insulin that are used to treat those who have extremely high sugars. I have gotten people who have called me and they want diabetes education, and when they went to hospital, their sugars were as high as 28. So at this point, before we intervene with diet, we need to at least bring down the sugars with insulin, and then we can progress to tablets, and then in time now reduce that and progress into the diet. So in terms of medication, we have several tablets that can be prescribed for you. We have medications such as metformin, which I used to use and not anymore, Amaryl, Triviamet, we have Bieta, we have Victoza, we have Glycet, we have Precos, we have Prandimet, we have Orines, we have Avandia, we have Oseni, Actos, and Actoplasmet. These are all different kind of medications that are used to treat diabetes, and they all serve different functions. Okay, so we've talked about the tablets, and we've also talked about the insulin. Let's get into the diet intervention part. Now, perhaps you had been admitted in hospital, your sugars were extremely high. They have been able to reduce the blood sugar using insulin, and then they have sent you home and told you to be on medication. But maybe after 2 weeks or 3 weeks, they want you to get into a regimen of using diet alone to manage your sugar. So what are we going to now do about diet? And now the question here is, if you want to manage your sugars using diet, you need to at least have approval from your doctor, and then you can have a diabetes nurse who is an educator working with you and giving you a meal plan and guiding you on that journey. Or alternatively, you can also have a coach like myself. I do coach because I have lived with reversing diabetes. I know what kind of foods are good to reverse and manage the condition. I can draw for you a meal plan. I can show you how to count your macros. So I can easily guide you on how to manage the condition, because we shall be working together. I will be sharing with you my experience. I'll be showing you how to cook. I enjoy cooking. I love cooking. It is my passion. I have an Instagram page, Munge Chef, where I showcase everything I cook. I manufacture my own bacon. I manufacture cheese. I manufacture my own bread, keto bread. I manufacture keto ice cream. I do the carnivore diet, but I'm also able to guide on the keto diet and also what we call the ketovore diet. The ketovore and the carnivore diets are subsets of the keto diet. So when we are starting to deal with diabetes using the low carbohydrate diet, we start with keto, and then we move to ketovore, and then to carnivore, because carnivore is extremely restrictive. So we start with keto, and then we go to ketovore, and then we come to carnivore. So what is low carb? Let us now get into diet intervention. Let us start by defining low carbohydrate diet. A low carb diet is where we restrict our carbohydrate intake from our carbohydrate intake. We are going to restrict it from 50 to 100 grams of carbohydrates per day. We are not going to take more than 100 carbs per day. So it means we have to literally count the amount of carbs that is in that food. Now, what is my role as an educator? My role is to guide you on how to count your carbohydrate, and this is why I want to coach you. I want you at the end of this broadcast to call me or WhatsApp me and tell me, Munge, I want you to coach me and teach me how to count 50 to 100 grams of carbohydrates per day, and I'm going to teach you on how to do that. So there is low carbohydrate, where you can be counting your carbohydrate intake per day. Then we can move to keto. Okay, low carbohydrate would be ideal for somebody perhaps who is like a breastfeeding mother or a pregnant mother, because we don't want to go too extreme and go into keto, because keto restricts the net carbs to 20 grams per day, which is a very small amount of carbohydrate, and there we need to be very cautious so that we don't get anyone into any kind of problem. So pregnant breastfeeding mothers can be on the low carbohydrate for 50 to 100 grams. I can guide you on that. I would not recommend that you go straight into that low carbohydrate regimen without a coach or without someone who knows how to count macros and guide you in the process. Keto means basically being on 20 grams of net carbohydrates per day. So here we are also counting the net carbohydrates. We need a scale, we need a food scale, which I have. I have a food scale where I measure the amount of food that I am eating. I know that in my breakfast meal, this is the amount of perhaps macadamia nuts I'll have if I'm doing keto. This is the amount of avocado I would have. This is the amount of spinach or broccoli I can have. And this is the amount of steak that I can have. So we limit that intake to 20 grams per day. Are we together? That is for keto. Now, ketovore is a subset of the ketogenic diet. So ketovore is a subset of keto. So on ketovore, we turn down the carbohydrate knob, we turn it to 10 grams of carbs per day. And what are we doing by turning down our carbohydrate knob? By turning down our carbohydrate knob, what we're trying to do is to rely on fat as opposed to relying on carbohydrate for energy. We have always been taught since the time when we were young that we need carbohydrates for energy. Now I am rewiring your mind. I am changing how you think. How? I want you to rely on fat for energy. Meaning that if you go onto a ketogenic diet, which I will guide you on, I will teach you how to appreciate good fat. What is good fat? Good fat is a food like an avocado. Good fat is a food like a macadamia nuts, pistachios, Brazil nuts, hazelnuts. Those are nuts that are high in fat. When you eat those kind of nuts, you feel satiated. Good fat is a steak. Good fat is eggs. Good fat is salmon fish. Good fat is sardine fish. Good fat is mackerel fish. Good fat is fatty mince. You get mince meat that is fatty, and then you form a burger patty, or you even make meatballs, and then you can eat that, and this will be good for you. Good fat is also bacon. So I want to rewire how you think. And be patient with me. Just listen to what I'm saying. I know your doctor has told you red meat is bad. I know your doctor has said don't take a lot of don't take saturated fats. I know your doctor has said this will cause cancer. This is not true. And I've always given the example that in Kenya we live among the Maasai community. This is a community that indulges and takes a lot of meat. The Maasai eat a lot of meat. They eat meat and they take a lot of bone broth, and they eat very fatty meat. And they are close to a tribe called the Inuit. The Inuit that are found in Europe they take very fatty meat as well, and their diet consists of just meat alone. And these people are never sick. And the rate of cardiovascular disease among the Inuit or the Maasai is very little. So let us rewire how we think. Let us not just take advice blindly just because we've been told by a doctor that don't eat butter, don't eat bacon because it will clog your heart with cholesterol. No. These are things we need to question. And actually, if you read the guidelines that are on the United States Department of Agriculture, they have revised the guidelines on cholesterol. They used to say per day they limit the cholesterol. You should limit your cholesterol intake to 300 mg per day, but now that has been removed. Why? They say that there is no correlation between the amount of cholesterol, the dietary cholesterol that you are eating, taking in to your body, has no correlation with the cholesterol found within your blood system, within your body system. So definitely that cholesterol that is within you is coming from another source and not from dietary cholesterol. And I'll explain to you that that other source is actually excess carbohydrate being turned into body fat. Are we together? So the enemy is carbohydrate, and the enemy is not fat. If you're eating healthy fat, if you're taking bone soup, if you're taking fatty meat, if you take a cow or a sheep and remove the fat, trim the fat and render that fat and turn it into cooking oil, there is certainly no problem with that. You can use it for your food. You can use it for baking. You can use it for cooking. It has no problem whatsoever. All right. Now I was on Carnivore. So Carnivore, we said we are on how many grams? 10 grams net carbohydrates per day. So here we are more cautious. We are still weighing our food. We have to count and confirm that on Carnivore we are taking a lot of meat but very little vegetable. And if we have to take a fruit, we take an avocado, a bit, and then we can take a bit of things like strawberry or blueberry, and then we can also take a bit of macadamia nuts, and then we can do maybe broccoli, we can do spinach, we can do cauliflower, but there we have to measure exactly how much it is that we are making, that we are eating. Remember, in all these plans, the low carb, the keto, the Carnivore, I'm in a position to sit with you and guide you, draw up a meal plan for you and guide you and also walk with you. I don't just guide you and give you a meal plan and walk away and leave you and shake hands. No, no, no. I will be there to exercise with you. I'll be there to cook with you because I enjoy cooking. If you want us to go shopping together at Carrefour or to the city market, I'll take you. If our programs can meet together, if we both have the time, we are going to sit together, talk, have tea in town, and then I'll take you to the market and I can show you how to shop for those things because that is my passion. So we've covered keto, we've covered low carb, we've covered keto, Carnivore, now we're on Carnivore. Now on the Carnivore diet, we turn the knob to maximum 0. Here it means no black pepper seasoning on your meat, no chili flakes. The only thing that we are going to use, no onions, no tomatoes in our meat. We're only using salt, meat, eggs, fish, bone soup. No coffee, no tea, and then we can also take water. We can take clear mineral water or we can take sparkling water to drink. No coffees, no teas, no herbal teas. It is a very, very strict diet. And this is the reason why I don't encourage people to go straight to Carnivore diet. You need to transition to Carnivore. You can start with low carb, then you move to keto, where I'm guiding you. I'm guiding you on low carb, then I guide you on keto, then on Carnivore, then on Carnivore. Because if you go straight to Carnivore, the withdrawal symptoms of doing the standard American diet, which we call the SAD diet, it's a very sad diet. It makes people sad, basically, which is what most of the world is on. Straight into the Carnivore diet, that change will be too radical and drastic and may cause you a lot of adjustment issues, and it could actually land you in hospital. So you need to be careful. And I'm telling you this because I have been there. I've been on this diet for 4 years, the ketogenic diet. I started with keto. I said low carb, then I went to keto, then Carnivore, now I'm on Carnivore. So I want to guide you through the stages. So let's be patient with one another. I will teach you, I will walk with you so that you can be well. Lion diet is the ultimate. After Carnivore, we have Lion. Lion is the extreme elimination protocol because we only do ruminant meat. What is ruminant meat? Ruminant meat is beef, and then goat and lamb. We don't do pork, we don't do chicken, we don't do fish, and then now we'll only do water. No bone soup. So that, again, there is a reason for being on Lion diet. Remember, for all these diets I have told you that are under the ketogenic diet, there is a reason why you need to be on each one of them. And we'll do an assessment with you. We'll sit with you. For those of us here in Kenya, I can even walk you into Healthy You. I'll walk with you into Healthy You. And we'll be able to get your vitamin and vitamin profile from Healthy You, and we'll be able to tell if you're deficient in things like biotin, magnesium, phosphorus, potassium, so that we can know where to place you and how to assist you. Are we together? Now, we have left the diet intervention part. Remember, diet intervention needs to be approved by a doctor, right? Now, let's go into exercise. Exercise is also very important. But before we exercise, we eat right, all right? So exercise, we are talking about cardio. Cardio is very important for people who are recovering from diabetes or who want to reverse it. Resistance training. This is something my doctor stressed on. You need to be on resistance training. So we do a lot of HIIT exercises. We do a lot of weights, not just cardio, not just running and walking, but also resistance training, where we are trying to strengthen our muscles. Are we together? I'm about to finish on my video, my YouTube video. So long term, what we want to do is, as a type 2 diabetic in recovery who has reversed diabetes, we need to stick to diet and exercise. So our ultimate goal as being in type 2 diabetes and who wants to recover, our ultimate goal is to stick to diet and exercise. So we cannot do exercise alone or diet alone. Both of them need to go hand in hand. But remember, diet comes first. For those who are type 1 diabetic, I have not left you out. I have a plan and a program where I can assist you, and this will be in conjunction with a very good group that are not based in Kenya. So I can be able to guide you on what to do if you're type 1 diabetic, because there's also hope for those who are type 1 diabetic to get into long-term diet plans where some have actually been able to get off insulin. All right, so here I want you to listen carefully. I'm not in a position to help you directly, but I can guide you with people who are actually doing this program, running this program. They're out of the country and they are able to assist you deal with the issue of managing your diet, and managing your sugars in such a way that they'll stabilize, and then the need for insulin will be removed. All right. So the thing is, as type 2 diabetic or as type 1 diabetic, you can fit in with everyone else, right? You can fit in, even if you have to go to a party, an event, you can fit in. All you need to do is to be you just need to be cognizant of your food triggers. You need to know what are your food triggers. We have said that there are people who are triggered by excess carbohydrate. We know that there are people who are triggered by dairy. Some people take milk and they get triggered. We have people who are triggered by wheat. They have wheat intolerance. We have people who have gluten intolerance. We have people who are lactose intolerance. We have people who have celiac disease. We have people who have irritable bowel syndrome, leaky gut. So if you know your food triggers, then you need to know what it is you need to eat, because this is how you're going to manage your life. You're not going to manage your life using medication for the rest of your life. You're going to manage it using diet. Remember, my mantra is healing in food, and let food be thy medicine. I love you all so much. Do not forget today that there is healing in food. Do not take that plate of food that is in front of you for granted. That plate of food can make or break your life. All right? Do not wait until it is too late. I have seen people who have gotten into diabetic neuropathy. They have had issues of wounds in their legs, and now they are saying they want to reverse the condition, but at that point of wanting to reverse, their leg is being cut off. Do not wait to get to that stage. Do not do not wait to get to the stage where your eye is giving you a problem, and then you go to the clinic and then they say you may go blind. You're already turning blind because of cataract or whatever other condition you may be having. I want you to do something about this condition today. If you know someone who is diabetic, if you're diabetic, please reach out. Let's have a chat. My number is +254. I'm saying this, I'm putting my country code because I know I have people who are viewing from outside the country. So we can also chat on WhatsApp. +254 700 000 797. That is +254 700 000 797. So I will be doing a second part of this broadcast or this video, and this is called Living with Diabetes Part 2. We're going to talk about caregivers who need to be educated and who need to understand the condition, and who would be a caregiver. A caregiver is your spouse, your parent, or if you're taking care of your parent, you're a caregiver. We're going to talk about complications of diabetes. This is very, very serious. Neuropathy, heart problems, eye disease, okay, liver failure, kidney failure, very serious. We need to talk about these complications. And then we're going to talk about multiple organ failure, which is just the stage that occurs before someone dies of diabetes. So that will be part 2 of living with diabetes and how to prevent getting to that stage of multiple organ failure. Remember this, I have told you, let food be thy what? Let food be thy medicine. I know I have been very busy. I have been doing my best to collect material and do a lot of reading. I am a signed up Patreon of very, very reliable doctors in the US who give me very, very quality information. So I can assure you, I want you to be better. I want you to eat the right kind of food. Please share my broadcast, subscribe to my channel, get me more subscribers. Let food be thy medicine. Thank you.